Hi, my name is Ross and I'm a student of physical therapy. Today I'll be taking you through a simplified version of the functional movement screen to help you figure out if you're at higher risk for injury during exercise. You can perform this test at home as we go. The functional movement screen is a test that consists of 7 different functional movement patterns that assesses your balance, stability, and mobility of your hips, knees, ankles, shoulders, core, and spine. The main purpose of this test is to identify asymmetries in the body and poor movement patterns. From there, we will be able to figure out what areas we need to retrain so that your body moves in a more stable and efficient manner. Studies have shown that even highly trained athletes are unable to perform many of these exercises properly. Also, in the athletic settings, many teams use this test to reassess their athletes to see if they're able to return back to their sport and meet the physical demands of the sport necessary. If you're having trouble performing many of these exercises or are experiencing pain, studies have shown that your chances of sustaining an injury during exercise is increased significantly. While this test does have a complete scoring system and is usually conducted by physical therapists, coaches, trainers, and other health professionals, today I'll be taking you through a simplified version of this test in order to help you perform these movements at home by yourself and to identify areas you might want to emphasize during your workout routine. For this first exercise, we'll be doing the deep squat. The purpose of this exercise is to assess your symmetry and functional mobility of your hips, knees, ankles, shoulders, core, and spine in one movement. You can start by having your feet pointed straight ahead, about shoulder width apart, then raising your arms above your head. Keep them extended and have an upright posture. In this position, you're going to squat down as deep as possible without having pain or leaning your trunk forward. The movement should look like this. Okay. With that movement, people tend to bend forward like this to get deeper, but you want to just stay upright as parallel as possible with your body without your knees caving in and keeping your back straight. Okay. Do not be discouraged if you're unable to perform this exercise. Many people lack the hip and calf flexibility. So if you did, I would suggest stretching your hip flexors and your calves regularly and practice squatting to a position in which you feel comfortable and in which you're having proper form. With that increased strength and flexibility, you should be able to squat deeper and deeper. For this next exercise, we'll be doing the hurdle step. The purpose is to assess single leg balance and coordination between the hips, knees, and ankles. For this exercise, you can start by standing straight up with your feet together and balancing on your right leg. You're going to raise your left leg as high as you can without bending over. So it should look like this. And you can perform this on the other side as well to see if there's any changes between each side. I'm going to perform this in a different angle. With this exercise, make sure that your knees, hips, and ankles and trunk are all in line and you're not bending forward or twisting at the trunk. If you had difficulty with this exercise, you can practice doing shorter step-up exercises with a small step, and you should be able to strengthen those muscles needed. This next exercise we'll be doing is the inline lunge. The purpose of this exercise is to assess ankle and knee stability as well as hip and trunk strength to prevent your body from rotating during the movement. You can start this exercise by having a staggered stance like this, making sure that your feet are in line and standing up straight. Make the distance between the 2 feet wide enough so that your back knee can lunge forward and almost touch the front heel of the front foot. So standing straight in line, nice and tall, in a controlled manner, you're going to go down and come back up in the lunge position. So it should look like this. Okay, this movement can be performed on the other side. as well. Make sure that you're set up before you start lunching. During this exercise, make sure you're not bending forward with the trunk or twisting at all. I'll perform this at a different angle. Okay, so make sure to do it on each side. If you had trouble with this exercise, you can practice lunging with a wider stance a little bit and just your body weight. And as you progress, you should be able to perform this exercise properly. For this next exercise, we'll be assessing shoulder mobility and whether or not you have impingement. With this, we're just going to check out your shoulder range of motion and posture. You can start by placing your arm over your head and raising it up as high as you can and doing it on both sides. If you had pain with this motion, it may suggest that you have signs of impingement. Next, if you did not have pain with that, we will move on. For this next one, you can stand next to a mirror, placing your right arm from the back and your left arm over your shoulder and making two fists. Bring your two fists as close as possible without having pain or without arching your back or twisting at all. Looking at the distance between the two, if it's between 1 and 2 hand lengths, then you have average shoulder range of motion. If it's a wider distance or you're having pain with this movement, then it may suggest that your shoulders are tight and you may need to stretch them. If you had difficulty with this, you may consider consulting your physician, especially if you have pain. For this next exercise, we'll be doing the active straight leg raise. The purpose of this is to assess your hamstring and calf flexibility, as well as your hip mobility and your pelvic stability. For this exercise, you can start by laying on the ground on your back. In this position, we're going to do one side at a time to assess your flexibility. Lying down straight, flat, you're going to raise your left leg as high as possible in this direction, making sure that this leg stays on the ground and that your knee is not bent. And during this movement, go until you experience moderate tightness and make sure that you're not arching on your back, which people tend to do. So raise it as high as you can and hold it there. Looking in the mirror, assess the distance and the angle of your leg. If it makes a right angle, then you have fairly good flexibility. If it's between 45 and 90, then you have some tightness in the hamstrings and calves. Also, if it's less than 45 degrees and down here, you have severe tightness of your hamstrings and may want to consider consulting with your physician. If you have shooting pain with this exercise, it may suggest that you have nerve tension. So that may also suggest consulting with your physician. Perform this exercise on the other side as well. It should look like this. Okay? If you had difficulty with this exercise, then I would suggest stretching your hamstrings in that position or sitting down and stretching like this one at a time. For this next exercise, we'll be assessing back mobility. You can start by being on your hands and knees. In this position, bend your knees and then bring your hips towards your ankles like this and bend forward, bring your chest down and your arms out. So it should look like this. You should be feeling a stretch in your back and in your arms. So it should look like this. I'll repeat it one more time. Okay. For this next one, you'll be on your stomach. Yes. Okay. Placing your arms, palms down and looking up. Bring your chest and extend your arms up. You should be feeling a stretch in the front over here. With both of these movements, you should not be experiencing any pain. If you do, you may consider consulting with your physician. For this next exercise, we'll be doing the trunk stability push-up. For this exercise, we'll be assessing core stability and strength. Okay, so in this position, you can get into the push-up position. On your feet and hands, and lie down. For men, you're going to place your thumbs in line with your forehead. Go like this. And make your arms shoulder width apart, or right about here. And then for women, it's going to be in line with the chin. So with this movement, your body should move as a plank in one movement up. So your hips should not be sagging, and your back should not be hyperextended. So the movement should look like this for men. Having your feet together, raise your elbows and arms off the ground. For women, you just put it at the chin level. And then you can modify this test if you're unable to do it. So for men, the modification would be putting it at the chin level, and women at the clavicle level. If you had difficulty with this exercise, you can try the modification and see if that works. If not, you can try doing push-ups on your knees. This next exercise we'll be doing rotational stability. The purpose of this is to assess core strength and balance, as well as energy transfer between the arms and legs. For this exercise, you can start on your hands and knees, and then you're going to place your arms directly under your shoulders, and make sure that your hips make a 90-degree angle, and you keep a neutral spine. In this position, you're going to raise one arm and one leg, making sure that you don't rotate during the movement. And then you're going to start by bringing your right arm up, and then your left leg out, keeping everything in line. So if I put a stick over your back, it wouldn't fall over. So in this position, from here, you're going to bring your elbow and knee together of the arms out and touch them and bring them back out. So it should look like this. Okay? And then you can perform this on the other side as well. Okay? So with this exercise, if you had difficulty with it, you can practice just being in this position and holding this position if you had difficulty with that exercise. Congratulations on completing this test. If you had difficulty with many of these exercises, you are at a higher risk for sustaining an injury during exercise. You may want to consider consulting with your physician or physical therapist to explore these limitations further before you experience an injury. If you had difficulty with only a few of these exercises, you may want to incorporate some of these exercises, variations of them, into your workout routine. Again, this test does not diagnose orthopedic problems or assess athleticism. It just gives you a better understanding of whether or not you are at a higher risk for injury. Good luck with your training.